Have you ever done this? You were in pain, took an anti-inflammatory, and then needed to take a corticosteroid because of allergies, asthma, or more severe inflammation? Two different medications, right? But what if I told you that this combination can harm your stomach and your kidneys, even though these are very common medications? Today, I'm going to explain in a simple way why you should not mix anti-inflammatory drugs with corticosteroids without medical or pharmaceutical guidance. What are these medications? Common anti-inflammatory drugs. For example, ibuprofen and diclofenac, used for pain, fever, and inflammation. Very common for muscle pain, headaches, and mild inflammation. They work by turning off substances that cause pain and inflammation. Corticosteroids, for example, prednisone and dexamethasone, are used for more intense inflammation. Allergies, asthma, autoimmune diseases, severe inflammation. They're much stronger anti-inflammatory drugs that act throughout the entire body. Both fight inflammation, but they work in different ways, and together they can cause serious problems. How do they work in the body? Imagine that your body has a natural protective system, especially in the stomach and the kidneys. Anti-inflammatory drugs reduce substances that cause pain, but they also reduce the stomach's natural protection. That's why they can cause gastritis and ulcers. Corticosteroids reduce inflammation more deeply. They also weaken the stomach's protective barrier, and they can affect blood pressure, blood sugar, and the immune system. Used separately, they already require caution. Used together, the risk adds up. The big problem, the interaction between them. Anti-inflammatory plus corticosteroid equals danger for the stomach. What happens? Anti-inflammatories remove the stomach's natural protection. Corticosteroids thin this protection even more. The result? Gastritis, ulcers, internal bleeding, sometimes silent. Many people only find out when they're already feeling very unwell. What about the kidneys? Anti-inflammatories can reduce blood flow to the kidneys. Corticosteroids can increase blood pressure and cause fluid retention. Together, they increase the risk of kidney injury, especially in older adults, dehydrated people, or those who already have kidney problems. But my doctor has prescribed both together before. Yes, that can happen in specific situations, but when it does, there is medical evaluation. A stomach protector is usually prescribed, the use is for short-term, and the patient is monitored. The real problem is mixing these medications on your own. Anti-inflammatory drugs and corticosteroids are excellent medications, but together, without proper guidance, they can become a serious problem. The MedimadeEasy golden rule. Common medications do not mean safe combinations. Always ask a pharmacist or a doctor. If this video helped you, like, share, and subscribe to the channel, because understanding medications is also taking care of your health.